Good afternoon. This hearing is called to order. This is the public hearing of the City Council Committee on Public Health and Human Services. And the purpose of this public hearing is to hear testimony on bills number 171, 125, and 180001. I want to recognize the presence of a quorum of committee members. In attendance are Councilwoman Blondell Brown, Councilman Bill Greenlee, and Councilman Al Toggenberger. And we'll now have the clerk read the title of the bill.
Bill number 171125, amending section 10-602 of the Philadelphia Code entitled Smoking by adding smoking restrictions at certain bus stops, all under certain terms and conditions.
Thank you, and I do want to ask the bill sponsor and other committee members if they have any opening remarks regarding this bill. Councilman Toggenberger?
I do, Madam Chair. Thank you very, very much. And just so, before we get to the hearing, there's a couple things about this bill folks ought to know. And, you know, sometimes when you visit schools, it's always a great opportunity to learn. And it's also a great idea to see the future. And you walk into any school, you'll see the future, for good or for bad. In this case, it was really great. In speaking to the social studies class of Ms. Liz Taylor, I had the opportunity to talk frankly to the students, and they with me, and a question came up regarding of smoking at bus stops. And the question was asked by Anna Van Nugent, and she had asked what my position was. Well, I said, after just a second, I said, well, I'm opposed to it. And I said, there must be legislation about it. And I said, but I will check into it. Well, there is none. And hopefully that will change by the end of this committee hearing. And she also later had an opportunity to speak to me about how smoking has played a negative impact, you know, in her life. And she commutes to school every day. And, you know, we need to do something about it, and that opportunity will come. But it's also important on 2 points also. One, legislators, and I know my colleagues are always very open-minded, but also for the public at large, to speak to their legislators, whether they're in city council or the state house or even the United States Congress, and let them know of their ideas, because that is how things move. And I'm very grateful to Anna and her teachers and the support of Masterman School to letting her be available to speak about this situation, and being in a position to do something about it, we plan to do so. So thank you, Madam Chair.
Thank you. Thank you, Councilman. Anyone else? Okay, and if we could have the clerk call the first witnesses to testify.
Ryan Kaufman, Director for Tobacco Control of Chronic Disease Prevention, Philadelphia Department of Health, and Anna Van Nguyen, J.R. Masterman School.
Good afternoon.
Thank you.
And you can state your name for the record and begin your testimony.
Ryan Kaufman, Tobacco Policy and Control Program Manager with the Department of Public Health.
And begin your testimony, sir.
Good morning, Chairwoman Bass and the members of the Public Health and Human Services Committee. I'm Ryan Kaufman, Tobacco Policy and Control Program Manager for the Department of Public Health. I'm here on behalf of Dr. Thomas Farley, the city's health commissioner. Thank you for allowing me to present testimony on bill number 171125, which, when enacted, adds smoking restrictions at certain bus stops that have a roof and at least one enclosed side. Thanks to Councilman Taubenberger, President Clark, and Councilmember Johnson for sponsoring this bill. The scientific literature shows strong and clear links between breathing in secondhand smoke and a wide range of adverse health outcomes, including cancer, heart attacks, stroke, and respiratory problems. Even short-term exposure to secondhand smoke matters. Just a few minutes is enough to cause airway constriction and changes in blood flow to the heart. People with heart disease and children, particularly children with asthma, are at especially high risk for adverse effects from breathing secondhand smoke and should avoid even brief exposures. Fortunately, this council understands the risk of secondhand smoke to Philadelphians and has passed laws and supported policies to decrease secondhand smoke exposure. But in city bus shelters, thousands of Philadelphians continue to breathe secondhand smoke every day while they wait for the bus to go to and from work and to school. For someone standing outside within a few feet of a person who is smoking, the level of exposure to fine particulates from secondhand smoke is about the same level you would get if you were near a smoker indoors. This risk decreases at a distance from the smoker increases, but extends to approximately 2 meters from the smoker. In bad weather, cities' residents face an unfortunate choice for themselves and their children, protecting their health or standing in the rain or snow until the bus arrives. Our work offices are located at 11th and Market, and bus shelters at that intersection have become de facto smoking shelters. When we allow people to smoke in bus shelters next to our city's young children, we send a clear message that smoking is normal and the health of our city's kids is less important than the convenience of people who smoke. Other cities as diverse as San Antonio, Texas, Albany, New York, and Gainesville, Florida, have taken action to protect the health of those using public transit systems by passing laws banning smoking in bus shelters. Ann Arbor went further, banning smoking within 10 feet of a bus stop. Philadelphia could join these forward-thinking sister cities in moving to protect the rights of entire people to clean and smoke-free air. Thank you for the opportunity to offer testimony on this bill. I will now respond to any questions. Thank you.
Thank you so much for your testimony. We're going to hold questions for right now. I want to acknowledge the presence of Councilwoman Kim. And next we'll hear testimony from Ms. Anna Nugent from J.R. Masterman School.
Good afternoon, members of City Council. My name is Anna Veen Wing, and I'm a senior at J.R. Masterman High School. Thank you for providing me with this incredible opportunity to be here and express my feelings for Councilman Taubenberger's bill. I'm excited that my voice was valued enough to be possibly turned into legislation. Thank you for caring, not only about me, but also about the public health of the entire city of brotherly love. I do not think it is fair that the well-being of some citizens is negatively affected by the habits of others. Customers of the Southeastern Pennsylvania Transportation Authority are suffering from secondhand smoke when they wait for a bus or a subway. 27% of Philadelphians rely on SEPTA to get to school, to get to work, to run important errands. Another problem is that riders cannot step away from a bus stop or train platform when there is a smoker present because that is the exact location at which the bus or subway will stop. Some citizens, like me, suffer from respiratory illnesses such as asthma, chronic obstructive pulmonary disease, or even lung cancer. Those especially at risk are Philadelphia's senior citizens and children. I was born with a congenital diaphragm hernia and have lived with asthma my entire life. I take the subway and the bus to and from school every day, and I cough a lot, have trouble breathing, and sometimes throw up because of the looming cigarette smoke when I am waiting. In November of last year, I ended up in the hospital for 2 days due to a severe asthma attack. While in the hospital, I was treated with steroid medicine, which caused me to gain a significant amount of weight, and I am currently trying to maintain my current state of health and not gain any more weight. After being discharged, I was not permitted to go to school for another week. When I finally returned to school, the doctors instructed me to take the elevators instead of walking up the stairs to get to class. I still have to take the bus and subway to school every day. Allowing people to smoke at transportation centers and bus stops is making my condition worse, not better. This is the current conspicuous problem, but can you imagine what the long-term detrimental effects on my lungs will be when I get older if I continue to inhale secondhand smoke day by day? I plead you to pass this bill to ban smoking at SEPTA public transportation centers, including Olney, Fern Rock, Frankfurt, and City Hall, and sheltered bus stops that have at least one enclosed side. Once again, thank you so much for giving me your precious time and hearing me speak. From one Philadelphia native to another, I truly hope that my voice and opinions will help others and reach a higher level. But my voice needs your yes vote to be successful and make change happen. Not only for me, not only for you, but it is also for the public health of the entire city. I hope that you will make the right decision and approve this bill. Thank you.
Well, thank you so much for your testimony. I have to say that I'm, just so proud of you for being able to come here today and to articulate how you feel and your experience. And so you should be very, very proud that your ideas, your suggestions have gone a long way to changing something that is detrimental not just to you, but to every citizen here in the city of Philadelphia. So you should be really, really proud.
Thank you.
The asthma rates in the city of Philadelphia are through the roof. That's not a secret. And so this is something that we can do, I believe we will do as a council, and I think something that, the SEPTA really should do in terms of having a very robust advertising of this new policy once it comes into effect. So we look forward to continuing to work with you and hear from you about how to implement such a policy. So, the reward for hard work is more work. So we're going to put you to work and look forward to working with you to really see this change happen. Councilman Talkin.
Yeah, absolutely. Mr. Kaufman, thank you for your expert testimony. And Anna, thank you for the idea, your willingness to speak up. And I hope you tell folks to speak to their legislators, to tell them what's on their mind on any subject. But this is particularly an important one because everyone assumed that everything was okay. Well, it's not okay. And hearing in your personal testimony about your difficulty with this, your freedoms to do what you wish to do kind of end when it starts affecting other people, and that's clearly what is going on with secondhand smoke, and particularly now when we know so much more about it as far as medical histories and tests that have been done and so on. I mean, when I was your age or younger, no one thought it was anything wrong with secondhand smoke, and certainly there was even a question whether smoking was affecting you. Well, now we know all the difference. But thank you for speaking up, for being here today. I also want to thank your teachers at Masterman for allowing you to come, because you are a student, and it's greatly appreciated. And so glad that you're here and you can be a part of this, because it was really because of you and many people like you that have not had the chance to speak to their legislators, their city council people, to do something about it. So I thank you very, very much.
Thank you, Councilman. Councilwoman Kim?
Yes, thank you very much. I just want to add my voice to the chorus here about congratulating Anna on her initiative and her passion for this issue. I had a chance to meet you earlier many years ago, and of course that promise has certainly been fulfilled, and it's really great for us both to be in these chambers talking about, a change in the city that will benefit a huge section of our population. So thank you, Anna. Congratulations on your efforts and work together. And we're looking forward on moving forward on it. Thank you.
Thank you.
Thank you. Councilman Toggenburger?
Thank you, Madam Chair, and I just want to allow the public to know, and particularly my colleagues, we are circulating an amendment. The amendment only strengthens this ordinance because it then requires that the city of Philadelphia post all the bus shelters to make sure that people actually know the rules and that they will be enforced. So whenever it's up to you, whenever we do that, that'll be ready.
Very good. Thank you, Councilman.
Thank you, Madam Chair.
Okay. Are there any other questions or comments from members of this panel? Seeing none, thank you very much for being here and for testifying today. And is there anyone else here to testify on this bill? Anyone? Okay. If not, the clerk will read the title of the next bill. Thank you very much.
Thank you so much.
Bill number 180001, an ordinance amending Title VI of the Philadelphia Code entitled Health Code by adding a new chapter 6-310 entitled Sodium Safety Warning Labeling for Chain Restaurants.
And can we have the first panel called forward?
Dr. Thomas Farley, Health Commissioner, City of Philadelphia. Duane Wharton, Food and Health Subcommittee Chair, Philadelphia Food Policy Advisory Council. Dr. Christina Roberto, Assistant Professor of Medical Ethics and Health Policy, University of Pennsylvania. And Dr. Bonita Faulkner, Pediatric Nephrologist, Thomas Jefferson University Hospital.
Okay. And good afternoon, and we'd like to start with Councilwoman Blondell Reynolds-Brown, the sponsor of the legislation. I had an opening comment. Councilwoman?
Please, thank you, Madam Chairwoman. Good afternoon, everyone. Hello.
Good afternoon.
This brings us to a milestone of about 6 to 8 month robust discussion around the issue of sodium and sodium labels. And so I'm thrilled that we have reached this juncture of our journey this morning. I want to say good afternoon to Chairwoman Bass and all the members of the Committee on Public Health and Human Services, as well as the number of stakeholders that are joining us today. We are pleased that we have reached the day of hearing Bill number 180001, which seeks to tackle one of our nation's and this city's biggest health crisis in our cities and urban centers across America. Fact, hypertension is a major problem in the city of Philadelphia. Also known as high blood pressure, hypertension can lead to or complicate a number of other serious health challenges, including, but not limited to, heart disease, stroke, diabetes, metabolic syndrome, trouble with memory and understanding, and so many more. Here's how big our hypertension problem is in Philadelphia. Fact, approximately 466,000 adult residents of the city of Philadelphia indeed have hypertension. That's nearly 500,000 people and almost 4 in 10 adults in our city. Philadelphia has the highest rate of premature deaths from heart disease of the 10 largest cities in the United States. Philadelphia has the highest rate of premature deaths from heart disease of the top 10 largest cities in the United States. We have estimates that hypertension costs more than $696 million in healthcare costs in the city of Philadelphia alone. As my staff and I have been reviewing this issue, we asked the health department to produce a map showing the councilmatic districts that have hypertension rates above the national average. That task is not unlike the same request I made at the health department in 2009 when I asked the health department to map for me diabetes and high blood pressure by councilmatic district. Because at the end of the day, we can have our opinion, but data are the facts. And so the map confirms that hypertension rates are above the national average in the following districts: the 2nd Councilmatic District, represented by Councilman Johnson; the 3rd Councilmatic District, represented by Councilwoman Blackwell. Hypertension rates are above the national average in the 4th Councilmatic District, represented by Councilman Jones, which has the highest rates in the city; the 5th Councilmatic District, represented by Councilman Clark; the 6th Councilmatic District, represented by Councilman Heenan; the 7th Councilmatic District, represented by Councilwoman Quiñones-Sánchez; the 8th Councilmatic District, represented by our Madam Chair President; the 9th Councilmatic District, represented by Councilwoman Parker; and the 10th Councilmatic District, represented by Councilman O'Neill. That is every Councilmatic District in the city of Philadelphia, with the exception of the 1st Councilmatic District. One of the most important steps a person can take to avoid hypertension is to reduce sodium intake. That's not opinion, that's science. Sodium menu labeling has allowed consumers to be warned if a menu item contains a dangerous amount of sodium. To be clear, the sodium label applies only to chain restaurants, so please understand that this is a continuation of the work we did around menu labeling now almost 7-8 years ago. And so this is our next step in working with the health department and other stakeholders to better inform and enlighten consumers. The daily amount of recommended sodium is 2,300 milligrams. That is a significant amount of sodium for one individual in one meal. Someone would have to tell me later how you measure milligrams. I don't know the answer to that. So know that our office has talked and worked and met extensively with the Philadelphia Department of Health. Thank you, Mr. Commissioner. Appreciate just who you are and what you do on a daily basis. The Law Department, researchers from the University of Pennsylvania, the American Heart Association, the Center for Science in the Public Interest, the Restaurant Association, restaurant owners and operators that have more than 10 here in the city of Philadelphia. So, while this is a bill in the right direction, it is not a perfect bill. While this is a bill that moves us in the right direction, it is not a perfect bill. However, it is an important step to further educate and enlighten citizens and do it in a way that is not onerous to achieve our goal of improving health outcomes and warn citizens about the dangers of excess sodium. And parenthetically, it's ironic that we're having this hearing today on the same day that the FDA just announced this morning. I'm a CBS Morning News watcher, and they announced this morning where nationally the FDA is requiring restaurants of 20 or more chains across the country to provide menu labeling. So it's really an incremental step of our first menu labeling bill, when we were the one city in the country that had the strongest menu labeling bill in the United States. So we want to thank everyone who's been a part of this dialogue, and I thank you, Madam Chairwoman. We will now proceed with testimony.
Well, I wanted to thank you, Councilwoman, for this piece of legislation, because I just really wanted to say quickly before you begin your testimony that menu labeling really does matter, and it does make a difference. I think that I've always tried to make good food choices, but now that we have menu labeling in the city of Philadelphia, I know that I'm making good food. I don't have to guess. You know, it was, I think I'm doing the right thing, but as we all know, you can think that you're eating something that's really healthy and it not be as healthy as you believe it to be. And as someone who is in that category who suffers from high blood pressure, yes, it's very, very important. So kudos to you on going after the sodium labeling. We appreciate that. And, sugar's next. So. But please state your name for the record, Commissioner, and begin your testimony.
Good morning, Chairwoman Bass and members of the Public Health and Human Services Committee. I'm Dr. Thomas Farley, Health Commissioner for the City of Philadelphia. Thank you for the opportunity to give testimony on Bill number 180001, which, if enacted, would require chain restaurants to place sodium warning labels on all menu items that contain 2,300 milligrams or more of sodium. My thanks to Councilwoman Brown for sponsoring this bill. Strong evidence supports the existence of a direct relationship between how much sodium people consume and their blood pressure. If people reduce their sodium intake, they're less likely to have high blood pressure. And if they have lower blood pressure, they're less likely to die of a stroke or a heart attack. This matters immensely here in Philadelphia because our hypertension rate and our rate of early death from heart disease are both the highest of the 10 largest U.S. cities. Hypertension, or high blood pressure, affects more than 1 in 3 Philadelphians and nearly 1 in 2 African Americans in our city. This difference is a major contributor to disparities in life expectancy. We know that 89% of Americans consume too much sodium. The average daily sodium intake is 3,400 milligrams, while the recommended upper limit is 2,300 milligrams daily. Decreasing sodium intake has the potential to lower high blood pressure rates by 25%, preventing hundreds of deaths per year from heart disease and stroke in Philadelphia. Many people want to eat less sodium, but it is not easy. The major source of sodium in our diets is not the salt we shake on our food, but instead the sodium that food companies and restaurants put into food. 77% of the sodium the average person eats comes from processed and restaurant foods. When people eat at restaurants, if they want to reduce the sodium intake, they find it particularly difficult. Some restaurant items contain more sodium than the maximum recommended for an entire day, as much as 5,000 milligrams or more in a single menu item. Right now, there's nothing that warns people about these extremely high sodium levels before they make their menu choices. The Public Health Department is taking action in multiple ways to help make it easier for Philadelphians to make healthy choices on sodium. We're working with city departments to implement Philadelphia's nutrition guidelines for foods purchased and served by any city agency. We have partnered with Temple University's Center for Asian Health and the Chinese Restaurant Association on our Healthy Chinese Takeout initiative. And we work with 16 area hospitals on our Good Food, Healthy Hospitals initiative, in which area hospitals have committed to following nutrition guidelines for the food served to patients, staff, and visitors. We strongly believe that Philadelphia should also help consumers by having a warning label on food items that have extraordinarily high levels of sodium. New York City passed and implemented a sodium warning label that withstood court challenge, with the judge ruling that requiring provision of this important public health information is permissible. Thanks to Dr. Christina Roberto's research, we know that a label that includes only an icon without the word sodium warning would be less effective than a label proposed by Councilwoman Brown and might even confuse some diners, leading them to think that the items were more flavorful. I urge the committee to approve the sodium warning label bill with the proposed amendments as a measure that will give Philadelphians who seek to improve their health the information they need to make healthier choices. Thank you for the opportunity to offer testimony on this bill. I'll be happy to answer any of your questions.
Thank you, Commissioner. We're going to hold questions to the end. And if we can have the next person state their name for the record and begin their testimony.
Good afternoon, members of the Committee on Public Health and Human Services. I am Dr. Christina Roberto, Assistant Professor of Medical Ethics and Health Policy at the Perelman School of Medicine at the University of Pennsylvania, where I direct the PEACH Lab, the Psychology of Eating and Consumer Health Lab. Thank you for allowing me to testify on Bill number 180001, which if enacted, would require chain restaurants to put warning labels alongside menu items or meals containing at least an entire day's worth of sodium. Thanks to Councilmember Blondell Reynolds Brown for introducing this bill. If you live in Philadelphia right now, you're more likely to die prematurely than if you live in any other of the 11 largest counties in the US. This is predominantly because of illnesses we can prevent. Salt has been aptly called the silent killer because excessive sodium intake contributes to high blood pressure, and high blood pressure, which isn't seen or felt, puts people at risk of suffering a stroke or developing heart disease, two of the nation's leading causes of death. For this reason, reducing sodium intake is critically important for our health. The proposed sodium warning label bill will arm Philadelphians with the information they need to make the choices that are right for them. The dietary guidelines for Americans recommend that we eat no more than 2,300 milligrams of sodium per day, but 89% of Americans exceed that daily amount. But it's not because people are adding too much salt at home. Research has demonstrated that 1/4 of our sodium intake comes from restaurant foods, many of which have shockingly high amounts of sodium. For example, the TGI Fridays Southern Fried Buffalo Chicken Sandwich, sorry if I'm making you hungry, has over 4,000 milligrams of sodium.
Oh my God.
And Chili's full rack of dry rub ribs has a whopping 5,000 milligrams of sodium. That's over 2 days' worth. Undoubtedly, many consumers order these meals without knowing that they contain so much sodium. Food labeling helps support healthy choices because it provides people with an easy and quick way to identify the food they want based on their own dietary needs. Food labeling can also encourage companies to offer healthier choices. This happened when the Food and Drug Administration required trans fats, a harmful type of fat in foods, to be included on the nutrition facts label. Over time, the food companies removed trans fat from their products so that they could proudly display 0 grams of trans fat on their labels. And this mass removal of trans fat from the food supply has been saving lives. Sodium warning labels could do the same. In my lab, we have conducted 3 online experiments with more than 6,000 people to study the potential effects of Philadelphia's proposed sodium warning labels. In these studies, we randomly assign people to see different types of sodium warning labels when selecting a meal from a Dairy Queen and a TGI Fridays menu. Then they made judgments about restaurant foods. We found that exposing people to sodium warning labels improved their understanding of the sodium content in restaurant meals. We also found that the design of the label mattered. Including the word sodium warning alongside a warning symbol like a stop sign was more helpful to consumers than showing a warning symbol without these words, like the current New York City label. We also compared language such as high salt versus high sodium versus sodium warning, and found that the word warning was more effective at encouraging lower sodium choices. There are many reasons why Americans overconsume sodium, but one major reason is that we have no idea how much sodium is in our food when we eat out. Studies show that on average, consumers underestimate the sodium in restaurant foods by 1,000 milligrams per meal. It's really hard for restaurant goers to control their sodium intake if they don't know which foods are high in sodium. We want to make it easy, not hard, for people to access key nutrition information that can support their health. This legislation will help Philadelphians make choices that are right for them. Thank you for the opportunity to testify. I'll now respond to any questions.
Thank you so much for your testimony. Mr. Wharton?
Hi. Good afternoon, Chairwoman Bass, Councilwoman Brown, and members of the Committee on Public Health and Human Services. My name is Duane Wharton, and I am an appointed member of the Philadelphia Food Policy Advisory Council, FPAC. Thank you for the opportunity to testify today on behalf of FPAC in support of Bill number 180001. FPAC's Food and Health Subcommittee advises the city on policies and practices that influence food and beverage choices with the aim of improving overall well-being and reducing health disparities for all Philadelphians. FPAC envisions that all Philadelphians can access and afford healthy, sustainable, culturally appropriate, local, and fair food. The widespread availability of high sodium content meals at many chain restaurants is in direct conflict with that vision. Cardiovascular disease is the leading cause of death in the United States and in Philadelphia. Of the 10 largest cities in the US, Philadelphia has the highest rates of hypertension and premature death. Countless studies have shown that excessive sodium is associated with elevated rates of hypertension, leading to increased risk of stroke, heart disease, and premature mortality. Almost every American consumes more sodium than guidelines recommend, and an estimated 25% of sodium intake comes from food served by restaurants. In 2017, Harvard University published results from a study that investigated fast food customers' knowledge regarding sodium intake. To your point, Councilwoman Bass, the study found that 90% of adults and 88% of adolescents underestimated sodium in their meals, with respondents underestimating sodium content more for meals with greater sodium content. The study concluded that education about sodium at point of purchase, such as sodium warning labels, may help correct consumer underestimation, particularly for meals with high sodium content. Consumer education is one way to inform the public about healthier options. Warning labels can help to reduce sodium intake, hypertension rates, and ultimately make our city healthier and save lives. We ask for your support in amending the City of Philadelphia Health Code to require sodium safety warning labels for chain restaurants. Thank you for this opportunity to testify today.
Thank you so much for your testimony. We really appreciate that. Before we go to questions from the panel, one of the things I just wanted to ask, and Commissioner, you're probably most able to answer this question, was when it comes to hypertension within the African American community, I do think that we haven't acknowledged the role of, that this being a hereditary condition. And certainly salt or sodium exasperates, what is already something that, is happening significantly in our communities. And I'll just speak bluntly that my high blood pressure came as a result of preeclampsia, which is a condition during pregnancy, and which is, common in, women after a certain age when you give birth. And so once it came, it never left. And how do we educate women, mothers, folks from the African American community about, even though you may monitor your salt intake, if it's in the blood, it's in the blood, and you have to be very, very careful about that. How do we go about acknowledging that and promoting and talking about that to at-risk populations?
So you're right, Councilwoman. The African Americans are definitely at higher risk for high blood pressure than other racial groups. It makes a big difference. And as a result of that, there have been recommendations in the past that African Americans consume less sodium even than other racial groups. So a maximum of 1,500 milligrams for African Americans. Different groups have different recommendations. But it is, that's a widely recognized problem, but it's not necessarily known by consumers. Right. And that happens, sodium increases your risk of high blood pressure, not just what you consume today, but what you consume over your entire lifetime. So we need people to consume less sodium every day from the moment they're born until they're adults, and cumulatively that'll benefit them. This bill addresses just one aspect of the problem, just the extraordinarily high levels of sodium in restaurants, and which we hope will prompt change to reduce the sodium levels in that food. There's plenty of other work we need to do, including educating consumers about sodium, educating consumers about this label. If this bill goes through, this gives us an opportunity to do that.
That'll be great. But I never knew that it was a cumulative effect.
Yes.
From the time you're a child.
Yes.
Until well into adulthood, that the sodium that you take in, has there's going to be an effect, over all those years.
Right, so, we assume that getting high blood pressure is something that's natural part of the aging process, but if you look at populations that don't eat a Western diet, that are more, hunter-gatherers, their blood pressure does not rise with age. It's not a normal part of the aging process. It's a matter of constantly taking in too much sodium, as well as other things that are unhealthy across the course of a lifetime. So we all need to consume less sodium every day.
Very good. Okay, good to know. Duane?
Yeah, may I add, my colleague Jordan Hughes will be speaking on behalf of the Food Trust, and as you know, part of the work that we do is a comprehensive approach to these issues. So nutrition education, increasing food access and healthier options in communities, all a part of it, as well as, speaking about cultural relevance to education for certain populations. So,
Okay.
thank you for that.
Very good, very good. Also, Dr. Faulkner is on this first panel. I'm sorry, I did not realize. Doctor, can we have you state your name for the record and begin your testimony once you're seated?
Yes. My name is Dr. Bonita Faulkner, and I'm an emeritus professor of medicine and pediatrics at Thomas Jefferson University, and I have spent many years studying blood pressure, the evolution of hypertension, the racial disparities of hypertension, and the causative or the contributors to hypertension. And there's, it's been very well established that salt intake, sodium intake, is a major contributor to hypertension and cardiovascular disease. And the American Heart Association recommends for all adults no more than 2,300 milligrams per day. An optimal amount, particularly for people with preconditions, is 1,500 milligrams. And the consumption, the average consumption, is well above those numbers. And it's largely from the hidden salt that we can't see, we can't taste, and really recognize. We need other ways of recognizing it. But I want to add to what has been previously said about children. And current evidence on the consumption and potential disease burden of dietary sodium is concerned with regard to children. The childhood obesity epidemic is well recognized. And concurrent with the childhood obesity epidemic has been an increase in blood pressure level and the prevalence of elevated blood pressure in children and adolescents. And it's, current estimates are that 17% of boys and 12% of girls have elevated blood pressure or hypertension. This is something that was previously not even recognized. We now know that blood pressure is increasing in childhood, and children are increasingly having the diagnosis of hypertension. And in addition to overweight and obesity, we know that dietary salt adds to the increase in blood pressure, particularly among children who are both either overweight or obese. So, and a recent analysis of sodium consumption by the CDC determined that the average sodium intake in young children, these are 6 to 11-year-olds, is 2,900 milligrams per day. That's already well above what's recommended for adults. And the average sodium intake increases with age, and in adolescents, 14 to 18 years of age, it's above 3,600 milligrams per day. So these numbers represent an average intake among children, and many are consuming far more than the average. So the summary CDC finding is that over 90% of children consume more than recommended sodium, and the food sources contributing to the high sodium intake are processed and commercially prepared foods. So for families, including children, parents, and grandparents, dietary consumption is high, and it's not easy for families to lower their sodium in their diets. So tools that would help families recognize the hidden salt in food products would be beneficial in helping them make healthy food choices. So thank you. I appreciate the opportunity to speak to you about this issue.
Thank you very much for your testimony. And one of the things I just wanted to acknowledge that you pointed out is around childhood obesity, because one of the things that I find particularly troubling is that the number of children who are having strokes, in recent years has just gone, it's really, really high, and it's very surprising. When I was coming up, it was just absolutely unheard of. I never heard of a child having a stroke. I didn't know of any children who had strokes, and I didn't know of anybody who knew of anybody who had strokes at a young age. But now, I don't want to say it's common, but I hear about it more and more. So clearly there's a problem.
That's true, and it's also of concern when you think about adolescent girls who are, becoming young women, they're pregnant, they just go into a pregnancy with high blood pressure. That has adverse effects on the fetus, the baby, and so forth.
Absolutely.
So this can just escalate.
Yes. Thank you so much for your comments. Councilwoman Brown?
Thank you. Two observations based on your testimony. Duane Wharton, you mentioned in your testimony at the point of purchase, and that's important. That was actually one of our sticking points with our menu labeling many, many years ago. There was an argument put forth that folks could read it on the kiosk, on the computer, or you could look for it in the back of a menu. And so what we learned is that when folks have the information on the front end, when consumers have the information on the front end, we indeed make different nutritional decisions. So I appreciate you raising that. And then secondly, just a matter for context, it was actually the National Institutes of Health report in 2007 that looked at obesity as a crisis in the country and an alarming crisis for African American children that triggered my interest on, so what can we do as a government around this issue? And it was at that time that Seattle and I believe New York were tackling menu labeling, and that became a possible answer for even the issue around childhood obesity. So context is important, and the issue of childhood obesity still haunts us as a city. So know that my staff and I thank you for your testimony.
Thank you.
Thank you very much, Council Lady. Councilman Greenlee, and then Councilman Toggenburger. And we've been joined by Councilman Green also.
Okay. Thank you, Madam Chair. Just a question. Maybe I should know this. The difference between regular table salt and sea salt. What's the difference in that?
There's no real difference. They're both sodium chloride. There may be a few other trace elements there, but and it maybe tastes slightly different, but as far as its sodium load and its health impact, no difference.
So sea salt might sound better because it comes from the sea.
Yes.
Tastes better on Brussels sprouts with olive oil. Yeah.
Pardon me? I'm sorry.
Yeah, no, it tastes better with Brussels sprouts and olive oil.
Okay, there you go.
One of the ways I think the food industry is trying to hide the high levels of sodium they're putting in food.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you. Councilman Toggenburger?
Yes. I want to first thank my colleague, Councilwoman Blondell Reynolds-Brown, for the leadership on this issue. I'm someone who has hypertension, so I take medication, but I really think this is a very, very good bill. But I want to ask the question to Dr. Farley, Commissioner Farley and Dr. Farley. Basically, I don't want it interpreted that I'm not for this bill. I'm enthusiastically for the bill, but I'd like to know a little bit of the mechanics. We are depending kind of on the industry like to do self-reporting, or is that not the case? How's that going to work?
Restaurant chains are already, chain restaurants already test their food for calorie content, fat, sodium, that sort of thing, and they make that information available on websites.
Oh, really? Okay.
Yes, and under the new national FDA rule, they are required to put the calorie counts on the menu, and they're also required to provide the additional information on websites and other places like that. So the chain restaurants already know the sodium levels in their food. We know that non-chain restaurants don't have standardized food preparation, so they can't do this.
Right.
So the chain restaurants already have this information.
Okay. And is there ever a dispute among who tested what, that maybe it doesn't meet a certain threshold or they're incorrect?
Basically, it's left up to them as far as the testing of their food items. There can be some testing that done, sort of auditing to see if their testing is accurate.
Okay.
I don't know of any studies that are showing that they're wildly off as far as their sodium levels. Some of the other experts here may know, but I'm not aware of that.
For conversation purpose, and of course, a law is what it's worth because of the ability to enforce. Not that it has to, it has to be enforced. People have to say what is actually in the food.
Right.
So, but you don't see the Philadelphia Health Department needing to test anything at this point.
I don't see that at this point. I should also point out, New York City, which has a warning label, they review menus, and then they identify those items that are more than 2,300 milligrams and communicate that back to restaurants and say, these are what we expect that you should have labels on.
Gotcha.
And we can take advantage of that information, likewise, when our inspectors do restaurant inspections.
Okay, and we have access to the New York?
Yes.
Okay. Commissioner, thank you very much. Madam Chair, thank you.
Thank you, Councilman. Councilman Green?
Thank you, Madam Chair. I would like to thank Councilwoman Brown for her leadership on this legislation. This, to me, is an extension of the menu labeling legislation that she did some years ago, which I know I personally benefited from because I have a better understanding of the calories in food. I am a very religious person in reference to counting all calories that I eat, and a lot of that goes back to Councilwoman Brown's legislation. But I did have a question in reference to this legislation regarding, I guess it's looking at the legislation, and it talks about not so much the menu labels, but the other type of display or display boards or menu boards that restaurants have from a technology perspective. You have certain restaurants that allow you to customize your food, and so is there ways that can be incorporated in the electronic menu board for a restaurant? So, for example, certain establishments allow you to mix certain things, and depending on you mixing the food products, that's definitely going to get you to a 2,300 or higher level threshold versus something else. If you think of certain sandwiches, if you change the bread or the condiments or add extra of anything, that automatically is going to trigger more likelihood that you're going to be over a certain calorie point. So is there a way that can be incorporated into the legislation? Because for a entity that has any type of computer technology, trying to come up with that 2,300 designation for each product may be more challenging. But if there's a way you can incorporate that in the beginning, saying if you select extra whatever, you're more likely than not going to have a higher calorie count, and that's really where you want people to make that decision making. Going back to me with menu labeling, you want people to make that decision or decide not to make a decision early on in the process regarding the steps that may be taken could have a high sodium count.
The way that the bill is written, if there's an item that has some options available within it, like you can have, comes with fries or salad, for example, then if any of those options brings you above 2,300 milligrams, it has to be labeled with the sodium warning. And so that's erring on the safe side, essentially, for consumers. Now, if there's many different choices and there's an electronic menu, as I've seen at some places, restaurants could have the salad combination with presented as one item and the French fries as another item, in which case then the only French fries one would have the warning and the salad one wouldn't, for example. But the way it stands right now, if any of the combinations get you over 2,300 milligrams, there's the warning.
And then also, I guess the other question is that looking at the legislation and my understanding that the sodium warning label would be a stop sign.
The current version of the bill, as I understand it, it's a triangle with a salt shaker in it, but then the word sodium warning appeared next to it. And this was
so you're going to have the sodium salt shaker.
Good point of information, yes. So the red stop sign we felt was onerous in the way it's presented, and that's based on feedback and discussions with New York City. And putting my educator hat on, we did not want to assume that if someone saw the salt shaker that they would know what that meant. So we added sodium warning coupled with a triangle with a salt shaker and the words sodium warning. So we make it explicit with both the symbol and the actual word sodium warning that we need you to have an alert button, if you will.
Okay, so it's not a stop sign, it's more the salt shaker as well as a word, the language, sodium warning.
Yes. And that's a part of our amended language, if I'm not mistaken.
Okay. Yeah, because I see the sodium warning, I just still see it looks like an octagon, which looks almost like a stop sign. And I guess my concern was that, some people are very visual, and so having a salt shaker with a line through it or something like that would then identify someone, okay, this is I mean, it indicates a salt piece, because sometimes people are they're multitasking, they're doing 5,000 different things, and they see a stop sign that they may just ignore that. But if they oh, okay, I see. Okay.
Yes, and after conferring with a number of the different stakeholders and actually doing an informal survey, this rose to be an even informed compromise.
Okay.
Okay?
All right. Thank you, Madam Chair.
You're
Thank you.
Thank you. Maybe we could make a skull and crossbones or something. So, okay, so thank you so much. Oh, Councilman Brown, did you have another? Okay.
No, I'm good, thanks.
Okay, thank you so much for your testimony. Thank you for being here. Okay, if we can have the clerk now call the next panel to testify.
Panel number 2, Tamika Quinn, National Spokesperson for Go Red for Women, Stephen Chu, President of the Greater Philadelphia Chinese Restaurant Association, and Carolyn Martin, Nurse Practitioner, participant in the sodium reduction effort with the Center for Asian Health, Temple University.
Okay.
Thank you, and please state your name for the record and begin your testimony.
My name is Tamika Quinn.
You can pull it forward to you. Yes.
Okay.
Yes.
All right. Good afternoon. My name is Tamika Quinn. I am a veteran, business owner, and a mother. I'm also a 2-time stroke survivor. I'm here today to ask Philadelphia City Council to pass the sodium warning label bill, which is the subject of this hearing, of course. Every day I cautiously contemplate my sodium intake. I am very, very meticulous when it comes to what I eat. I speak personally for myself and thousands of Philadelphians who must also carefully monitor the amount of salt that we eat and track blood pressure levels to ensure we can continue healthy and fulfilling lives. We all stand to benefit enormously from the proposal before you, as this legislation will alert me and everyone across the city about dangerous levels of sodium in our food. I grew up in this city. I started a family in this city, and this is my story. When I was little, I lived in North Philly. I remember going with my grandmother on 2 buses up to Bala Kenwood to grocery stores, because those stores had fresh fruits, fresh vegetables, and just a better quality of food. We enjoyed and served fresh fruit and vegetables at our table and made it a priority. Many of my family members had high blood pressure, but no one talked about it. I myself had always struggled with my weight. I was the heaviest cheerleader on the squad. When I was 27, I developed high blood pressure also while pregnant. It was called preeclampsia. This was with my 3rd child. 10 days after my daughter Sequoia was born, I woke up with an excruciating headache. My regular doctor wasn't available, so I went to an urgent care clinic where I was given painkillers and medication for my high blood pressure. The pain intensified, so I went to the ER. Everything came to a screeching halt when I was diagnosed with a hemorrhagic stroke. 3 days later, I had a 2nd stroke, and I was only 27 years old. A mom, a wife, a business owner, and never in a million years would I have thought that I would have a stroke. It took me months to recover my ability to walk and speak. These strokes were a frightening wake-up call, and today I maintain a healthy lifestyle. Over the years, there have been times when I would eat unhealthy foods or not take my blood pressure medication like I was supposed to. My doctor once said to me, I was literally heading down a path for a stroke again. And I can tell you that in my community, it wasn't abnormal to be a little overweight, and it wasn't abnormal in our family to have high blood pressure. But until I had those strokes, I didn't even take my health seriously. After we went through that as a family, I signed up, all of us, for a nutrition program through CHKD Hospital to overhaul our eating habits. Exercise also became a priority. Now, today, we make healthy choices in our home every day. But when it comes to having meals at restaurants or ordering online for pickup, it's difficult to enjoy and ensure the healthy option when we don't know what's in the food. It's critical to know what's in our food, especially the amount of salt, to take control of our diets. A warning label that is easy to interpret and read will give consumers like me the information we need to make healthier choices and stay alive. My story doesn't define me, but it has shaped who I am today. I am stronger because of my life experiences, and I am now a fierce advocate for heart and brain health. There are countless other stories like mine throughout this city, and we have the opportunity today with this proposal to make a huge impact. I need to watch my sodium intake, and I'm not alone. A sodium warning label has the potential to save Philadelphians' lives. I want to thank you for moving this important piece of legislation forward. On behalf of myself and the American Heart Association and American Stroke Association and the people of Philadelphia, we thank you for this opportunity to share my story and to present support for Council Bill 18000-100. And I want to end with sharing a photo of myself and my daughter who has benefited from our lifestyle change. This is my daughter who at 8 years old was diagnosed with high cholesterol, and cardiologists wanted to put her on statin medications. I refused. However, the doctors told me that with her cholesterol level being so high and her weight being so high, she could have a stroke just like I did. And so that was what pushed us to make this drastic lifestyle change in our family. I did not want my daughter going through the same things that I had gone through. And as a result, thank you, not just have I lost close to 80 pounds, my daughter has lost 40 pounds. We have changed our lifestyle within our immediate family, but we have seen our extended family now changing their lifestyle as well and eating less salt, eating less fried foods, drinking more water, and just making a healthy lifestyle change to have a better life.
Thank you so much for your testimony. I have to leave the chamber, but Councilman Bill Greenlee is going to continue the hearing going forward as the chair. But I did want to just comment on your story because it really resonates with me as well, as I said earlier. You know, my preeclampsia, you know, really came on during, well, the high blood pressure came on with preeclampsia during pregnancy. And so I'm not going to go into the details, but my story very much resonates with what you just said. And I think that people don't take it seriously. I'll just say I didn't take it seriously until I took a blood pressure reading shortly, you know, just days after my daughter was born, and it was 2 something over 1 something.
Wow.
And so, I certainly do recognize and resonate the importance of doing something about sodium, about the intake, and about recognizing how dangerous it really is. And so again, I just wanted to thank you for your story.
Thank you.
I do have to excuse myself from chambers, but Councilman Greenlee will continue from here. Thank you.
Thank you, Madam Chair. Whoever would like to go next, please. Identify yourself and proceed.
My name is Carolyn Martin. Good morning, or good afternoon first. My name is Carolyn Martin. I'm here today also in support of the sodium warning label. I'm a registered nurse. I'm retired. I'm a mother. I'm a grandmother. And I'm a great-grandmother. And I know the importance of eating healthy and the impact that it can have on your health. I've been married for 60 years. I have 14 grandchildren, 2 great-grandchildren. And I try to influence them to eat healthy. not so much by what I say, but what I do, because I've found that they will follow what they see me do. I walk every morning for 3 miles or for an hour every morning, at least 5 to 6 days a week, and have been doing it for 20-some years, and they have seen me do that. But I also take time in what I eat and in reading labels. I don't push them, but I just continue to do what's right myself, and as they see me do those things, they seem to follow. I have 2 granddaughters approaching 30 years old that live in the house with me, so they see more closely my habits, and they too take on some of those habits, especially those in eating and in shopping. But we have found the importance of reading labels so much for the sodium content. I also have, because my husband is a pastor, I have the influence over a congregation, but also we have a feeding program at our site, and I find that it has an influence, we can influence many people in that way, just in subtle ways. Often I'm asked for a salt shaker when they're eating, and that gives me just the open door to tell them the importance of not eating salt, and that we don't even have salt shakers in our home or at the church when we're feeding the community. I would like to continue by saying that in restaurants, I don't eat out that much, but in those that I eat, I'm very important to me how much sodium is in the food, and I've found that in some of the fast food places, they will not even tell you that or do not list that unless you request it. Having done that on one occasion, I found that there was such high sodium content in the food, and it was in a healthy salad, that I thought I was eating a healthy salad and had my family requesting that same salad until I requested the labeling for that salad and found that I had to discontinue using that salad as a healthy option. We know that too much sodium can cause high blood pressure, stroke, and disease, and heart disease. And so this labeling is very important to me, to my family, to our congregation, to those whom we feed, from the community. Thank you for considering this an important legislation and for allowing me to speak today and share my support.
Thank you very much, Ms. Martin. Sir, please identify yourself and proceed.
Okay. Good afternoon, Council Member. My name is Stephen Xu. I'm the president of Greater Philadelphia Chinese Restaurant Association. Thank you for the opportunity to testify in support of Bill number 18001, which would require sodium safety warning labeling for chain restaurants. The sodium warning labeling bill is very important, as it will help to reduce sodium consumption and improve the health of Philadelphia residents in Philadelphia. In Philadelphia, about 40% of the city residents has high blood pressure, and in the African American population, the number jumped to 47%, which increased the risk of stroke and heart disease. There are more than 400 Chinese takeout restaurants in Philadelphia, the majority of which are in the low-income Afro-American and Hispanic community. Many of these neighborhoods doesn't have easy access to fresh, healthy food and a grocery store, a corner store. So this takeout restaurant become a major point of food access. Starting in 2012, in collaboration with the Philadelphia Department of Public Health and the Temple University Center for Asian Health, we have worked with 206 Chinese takeout restaurant business owners and a chef to reduce the sodium content in food. Chinese takeout business owner and the chef receive education and training to prepare low sodium food. This was a unique citywide effort to prevent hypertension and heart disease among the racial ethnic minority groups in Philadelphia by decreasing the sodium content in meal service at these Chinese takeout restaurants. The neighborhood residents served by those Chinese takeout restaurants are very happy with low sodium food in the restaurant in their community. Restaurant post sign informing customer about the effort to reduce the sodium in their food and the impact sodium has on health, and how intake can cause high blood pressure and the increased risk for stroke and heart disease. Many residents told takeout business owner, we appreciate your healthier, low sodium food, and for educating us about over sodium and our health. Some of them also told the owners, you take care of my health. You are a good business in our community. We thank you for your effort. And while the Chinese takeout restaurant would not be affected by this registration, the initiative is a good example of how sodium reduction effort in the city have had a positive impact on both business owner and the community. If a small independently owned restaurant can take a step to address sodium reduction, it is imperative that chain restaurants do so as well. Thank you again for consideration this registration and providing the opportunity for Greater Philadelphia Chinese Restaurant Association to share our support. Thank you, all of you.
Thank you, sir. Thank you, all three. Councilwoman Brown?
Yes, thank you all very, very, very much. Personal stories and personal testimonies have purpose and give us, remind us of why we're in the business that we're in on this side of the table. I am completely appreciative of I want to be clear, the Greater Philadelphia Chinese Restaurant Association for bringing your voice to the table. It matters. It goes a mighty long way, and it's a clear signal that your community is paying close attention. So we thank you for being a voice and registering the voice of your association this afternoon. It's much appreciated.
Thank you.
Thank you all.
Councilman Talkin.
Yes. Mr. Chairman, thank you very much. Dr. Zhu, I also want to echo what my colleague, Councilwoman Brown, had said. Councilwoman Brown is, once again, taking the lead on this, but your association being here, I think, is very, very important. Mr. Zhu, approximately how many members do you have of your association?
Currently, we have over 300 members, but it take our restaurant in the citywide about more than 400.
Is that limited? I see by the title, it's not just limited to the city itself, but
in the
outside
citywide,
the city as well, which is great. I mean, I think anything that binds us together, coming from the perspective of being the former executive director of the Northeast Philadelphia Chamber of Commerce, having input from all around, I think is very helpful. The fact that you're here speaks volumes, that you want your clients, your restaurant goers, those that are in love with Chinese food, and I am one of them, that you're here actively participating in the health of our city. So I thank you.
Thank you. Thank you, Councilman. Again, thank you, all three of you, for your time.
Okay.
We appreciate your testimony.
Thank you.
Thank you. Do we have the final panel we want to call?
Jordan Muse, External Affairs Associate, Food Trust, and Dr. Lawrence J. Apple, Director of the Welch Center for Prevention, Epidemiology, and Clinical Research, Johns Hopkins University.
Okay. And let me just double check. Anyone else here to testify on this bill? No? Okay. And for the record, we also have written testimony from Hillary Karan, if I'm pronouncing that right, Senior Policy Associate for Center for Science in the Public Interest. Written testimony will be made part of the record. Whoever would like to go, Ms. Muse, I think you were called first, so why don't you go first? Yep. Okay. Identify yourself and proceed.
Jordan Muse, the Food Trust. Good afternoon, Councilwoman Reynolds-Brown and members of the Committee on Public Health and Human Services. My name is Jordan Muse, an External Affairs Associate for the Food Trust. Thank you for the opportunity to testify today on behalf of the Food Trust in support of Bill number 180001, which would amend the City of Philadelphia Health Code to require sodium safety warning labeling for chain restaurants to educate consumers about menu items that contain at least 2,300 milligrams of sodium, the amount in 1 teaspoon of salt. The Food Trust's mission is to ensure everyone has access to healthy and affordable foods and the education they need to make healthy decisions for them and their families. As part of our comprehensive approach, school and community-based nutrition education aims to teach people how to make healthier choices for themselves and their families. You've heard quite a bit of stats, so I won't belabor all the statistics that you heard. However, I do want to emphasize that 77% of the sodium we consume comes from processed foods as well as restaurant foods. And many of the menu items of fast food restaurants contain a day's worth of sodium. And we need to find ways to decrease sodium intake across the board. Sodium warning labels present an opportunity to educate our communities about what they are consuming so that they can make an informed decision. The sodium warning label is a key tool in efforts to reduce chronic disease and close the health gap. We believe this can have a positive health impact by reducing sodium intake, thus reducing hypertension rates, heart disease, and strokes in our city. For these reasons, the Food Trust supports amending the City of Philadelphia Health Code to require sodium safety warning labels for chain restaurants. Thank you.
Thank you very much. Doctor, we have your written testimony. If you'd like to just summarize, we'd appreciate it because we're running a little time freight issue
Sure,
here.
I'll avoid being redundant. My name is Larry Apple, and I'm an internist by training. I'm a professor of medicine at Johns Hopkins, and I spent a good part of my life conducting research on how to control blood pressure, ideally through diet and lifestyle modification. I'm, like everybody else here, gravely concerned about hypertension in Philadelphia, our communities, our nation, and these efforts that you have are really important to improve transparency. It is a massive public health problem, elevated blood pressure. It's been linked to excess heart disease, stroke, and kidney disease. I think one thing that hasn't been emphasized is that 90% of adults will develop hypertension over your life. So if you don't have hypertension already, you will develop it, and most of your family will develop hypertension. I also want to emphasize the point that Dr. Farley and Dr. Faulkner mentioned. It is a lifelong problem starting probably at birth, and that blood pressure rises more steeply in individuals who develop hypertension to the point that it becomes elevated where individuals need treatment. But it is a lifelong problem, and this is why we want to start early in life, including our children. America today, in Philadelphia, is no exception. Average person adult consumes 3,400 milligrams. The hypertension epidemic is worse in some communities, and there are, as several people have mentioned, substantial health disparities. 48% of black Philadelphians have hypertension in comparison to 31% of whites. I would also like to mention at this point one of our major studies that actually informed dietary guidelines. Sodium reduction lowers blood pressure in blacks and whites, but the effects in blacks are greater than the effects in whites. And it is a proven means to reduce racial disparities in health, and I don't think that's been emphasized as much. As individuals have already pointed out, 70% of sodium comes from packaged, prepared, and restaurant foods, and yet many, if not most Americans, are unaware of the sources of sodium. So I applaud the ongoing efforts, including the research done by the Philadelphia Department of Health on this issue, and on the most effective type of warning icon. Warning label must be clear, easy to interpret by consumers, including those of all literacy levels and those who cannot speak languages, do not speak English. I want to emphasize, and this is to reiterate research done by Dr. Roberto, the octagon is a universal and internationally understood symbol that means something to everyone who sees it. So, in addition to the having a transparent and effective label, warning label should be placed where individuals can see it, either in person on printed menus or online via the web. Warning labels should be included on any menu item that exceeds 2,300 milligrams, regardless of whether that it is offered as a specialty item, a promotional item, or as a limited time item. It's incredibly important for transparency and will allow consumers to make decisions that affect their health. I would like to also take this moment to express some concern from the American Heart Association around the exemption of specialty menu items in the bill language, and that exemption that is going to be applied to items offered up to a 60-day period, and this will include many items, and more importantly, consumers will unknowingly be consuming high amounts of sodium. The American Heart Association is not in favor of this amendment. As a result of my extensive experience and as a researcher and as a clinician, I do support the Philadelphia City Council's efforts around this piece of legislation. It'll encourage better dietary habits in Philadelphians, and is a pivotal step to improve the health and lives of people in your community. I thank you for the opportunity to speak today, and I applaud you for your efforts. And by the way, in addition to doing the research, I chaired the committee that set the 2,300 milligrams as the upper limit, and I served on 2 dietary guidelines committees.
Thank you. Thank you, Doctor. Appreciate it very much. Thank you both. For the meeting, or you want to say something?
A matter of record for the New York Health Department.
Oh, okay. Yes, Councilwoman Brown.
We just learned that the New York Health Department did submit written testimony, so we deeply appreciate them weighing in and paying attention to what the national trends are. And further, I should stipulate that this bill just received the support of Mary T. Bassett, who is our commissioner's counterpart in New York City. She's the Commissioner of Health for the New York City Department of Health. So we don't take those type of endorsements lightly. In fact, we appreciate it very much.
Thank you. Thank you, Councilwoman. No other questions. Thank you all very much. That concludes the hearing of the Committee on Public Health and Human Services. We'll now go into our public meeting, and the chair recognizes Councilman Taubenberger.
Thank you, Mr. Chairman. I have circulated an amendment.
Push your button.
I thought I did. Oh, well, you put it. Thank you. Thank you. Thank you for your help here. I have circulated an amendment to all members of this committee, and I ask for that amendment to be moved forward.
Second.
It's been moved and seconded. The amendment to Bill number 171125 be approved. All in favor?
Aye.
Opposed? Hearing none, amendment is approved. Councilman Taubenberger.
I move the bill as amended with the suspension of the rules.
Is there a second?
Second.
It's been moved and seconded that Bill number 171125 as amended be reported favorably with a rule suspension. All in favor?
Aye.
Opposed? Hearing none, that motion is approved. Chair now recognizes Councilwoman Reynolds-Brown.
Yes, Mr. Chairman, I do offer an amendment which has been circulated to all members and to our stakeholders database, stakeholders for their information as well. And in short, the amendments do the following. They allow for a 1-year implementation date. Our goal is never to be onerous with businesses of any type. And so in talking with the business community, we thought it appropriate and fair to give them time to rework their menu documents. This also includes a label change, which was based on an informal survey, and we've ended up at the place where we have. This amendment also clarifies that the label is for menu items. It is not for menu items and customer add-ons, which goes to Councilman Green's excellent observation. That too was heavily discussed, and it will clarify a label for menu items, but as customers add on, it will not captured those of us who want to add pickles and chips and mayonnaise and et cetera to our menu choices. And lastly, it will allow for a 60-day seasonal menu item exemption. In the interest of full transparency, this is not universally accepted. However, it was a compromise, if you will, and I want to offer this amendment with no suspension of the rules, but to allow for subsequent conversation and discussion between now and the second reading and final passage, Mr. Chairman.
Okay, so there's a motion on the floor for the amendment to Bill number 180001. Is there a second?
Second.
It's been moved and seconded for the approval of that amendment. All in favor?
Aye.
Opposed? Hearing none. Now, Councilwoman Reynolds Brown on the bill as amended.
Yes, Mr. Chairman, I move that Bill number 18001 as amended be moved out of committee with a favorable recommendation.
Second?
Second.
It's been moved and seconded that Bill number 1800001 as amended be reported out of committee with a favorable recommendation. All in favor?
Aye.
Opposed? Hearing none, the motion carries, and that concludes the meeting of the Committee on Public Health and Human Services. Thank you all very much.
Thank you.